University is medical training governor, Dr. Asim in medicine unit 2. तो फर्स्ट ऑफ ऑल तो बड़ी खुशी होती है कि इसी हॉल में जिधर हम टॉक लेते थे मुझे ये याद में एज अ गेस्ट स्पीकर मुझे इनवाइट किया गया। थैंक यू सो मच टू अलुमिनाई एंड सबसे पहले मैं तो ये कहना चाहूँगा कि जो आपके टीचर्स हैं जो आपको इस स्टेज पे पहुँचाते हैं उनकी रिस्पेक्ट जो है वो आपको आगे लेके जाएगी। बाकी का सारी चीज़ें सेकेंडरी हैं, एवरीथिंग इज सेकेंडरी। सबसे इम्पोर्टेंट चीज़ ये है कि आप अपने सीनियर्स की और अपने मेंटर्स की रिस्पेक्ट अगर करते हैं तो यही वो लोग हैं जिन्होंने आपकी हेल्प करनी है और इनकी दुआओं से और इनकी मेहनत से आप लोगों ने आगे जाना है। So about my journey, since I am from batch 3, तो हमारे जो सीनियर्स हैं उनकी गाइडेंस नहीं की हमें हमारे दौर में। अब तो ग्रेजुएट माशाल्लाह अलुमिनाई भी है, ग्रेजुएट आपको गाइडेंस भी मिलेगी, क्लैरिटी भी मिलेगी और एमएलटी भी मिलेगी। मुझे कॉन्ग्रेचुलेशंस फ्रॉम गेटिंग मैथ। शायद आपको याद ना हो जब आप आई थिंक सो यू आर इन थर्ड ईयर तो कैफे में एक दिन आपके साथ बैठा हुआ था और आप परेशान थे कि मैंने आगे क्या करना है। एंड मैं क्रेडिट तो नहीं देना चाहूँगा पर मैंने आपको कहा था कि गो फॉर एमएलए एंड यू वर थिंकिंग अबाउट एमएलए एट दैट मोमेंट। और आज वो दिन आया है कि आप मैच हो गए हैं तो इसकी बहुत खुशी है हम सबको। और मैं उम्मीद करता हूँ कि यूएसए का जो बात है उसमें आप जेएमएस को फर्दर गाइड करेंगे और इसी तरह हमारी यूनियन जो है वो फ्लरिश करेंगे। प्लान मैंने 2 साल पहले कर चुका था। आई एम न्यू से रजिस्टर्ड इन बैक इन लास्ट 2 years, but at the same time I got induction in FCPS medicine in Gujranwala, so my mind changed a bit and now I will see that maybe FCPS के बाद जाना है या there are several other routes to go to UK. You have a C program of CPSP, you can go to UK to that to test out. ज़्यादा टाइम नहीं लूँगा, मैं अपने टॉपिक पे आता हूँ। जो टॉपिक मुझे दिया गया है क्लैब, दैट इज जीएमसी रजिस्ट्रेशन वाया क्लैब। फर्स्ट ऑफ ऑल क्लैब, द नेम ऑफ द एग्जाम हैज नॉट बीन चेंज्ड, इट इज नाउ यूके एमएलए। ऑलराइट, सो अ पैटर्न इज बीन चेंज्ड एंड द नेम इज चेंज्ड। आई विल टेल यू द डिफरेंस बिटवीन क्लैब एंड यूके एमएलए नाउ। सो what is UKML? UKML is actually UK Medical Licensing Assessment Exam. It consists of 2 parts, and in order to be eligible for this exam, you need to clear English proficiency test. There are 2 options for that. One is OET and the other one is RS. We will talk about those further in a moment. So UKML is a new licensing exam, and after clearing both the parts, you get the GMC registration, which is required to practice medicine in UK. There are several other pathways to get the GMC registration. For example, membership exams, membership exam of medicine, of gynae, MRCOG, membership exam of surgery, that is MRCS. You can also get GMC registration via those routes. And definitely UKML is the shortest and the quickest route through which you can get the registration. It is not some sort of any sort of postgraduate degree. It is just a licensing exam. So what are the steps to get the GMC license for UKML? As I already mentioned, first of all you need to give the English proficiency test and 2 options being OET and IELTS. After that you will give the step 1 of UKML, that is now renamed as AKT, which is Applied Tonic Test. Initially it was known as CLAP 1 exam, and the step 2, which was initially known as CLAP exam, is now it would be called as Clinical and Professional Skill Assessment, CPSA. There are minor differences between the exams, and I will tell you about those. So first of all, in order to be eligible, you need to clear OET or IELTS, and there is certain criteria which you need to meet in order to be eligible. So for OET, there are 4 subtests: reading, writing, listening, and speaking. These are the 4 parts in which you need to show your proficiency in these subtests. And in order to be eligible, you need to score at least B grade. And for oils, there is also a criteria you need to score 7.5 band with a minimum of 7 band in each part. OIT is specifically designed for healthcare professionals. So in OIT, take for example the speaking circus. You are given a task that you need to speak, or you need to have a conversation with the patient or a doctor, and the setting would be, for example, in a hospital, and a specific medical case would be discussed. So for a doctor, obviously it seems a bit easy, as for example, the topic which is going to be discussed would be of medicine. While in case of IELTS, it is a general understanding test for various purposes, including immigration process. So, some of my colleagues and juniors and seniors have scored in OIT and some have given IELTS. So it is basically used twice. For me, I think so OIT is a better option, as the terminology is aligns well with the demand of medicine. While in case of IELTS, it is a general English language test. Now coming to the steps of UKMLA. The step one. So the step one is applied knowledge test. It is actually a test in which there are several options, and you have to select the best option. It is MCQ based exam, and initially there were 180 MCQs, and now there are 200 MCQs, and you get 4 hours for this exam. 100 MCQs, for 100 MCQs you get 2 hours, and then there is break, and then another 2 hours for the next 100 exams. So what's the difference between Lab 1 and AKT? UPMLA is going to be practiced from next month, that is from June. All my colleagues and everyone who has gone to UK has gone to via plan pathway. The UPMLA pathway is going to be started from next month. So none of us has given this exam until now, but from the next month it will be applied. So what's the difference? So the platform it usually focus on biomedical science and clinical knowledge, while AKT it emphasizes on the clinical scenarios. Like you have the basic knowledge, you have the clinical knowledge, how you would apply in clinical setting. Such sort of activities will be present in AKT. Alright, initially it was more of basic sciences and clinical knowledge in lab, but now it has been changed to application of clinical knowledge to the real world scenarios. So this is the main difference. And second main difference is that for lab 1 you fill the circle and the exam was on a real paper, while now the exam is going to be conducted on computer, and MCQs are now 200. So you have to select the best option. This is the main difference between lab 1 and UKMLA. As I already mentioned, there are 200 MCQs, and it would be 2 parts, 100 MCQs at a time, and then break, and then another 100 MCQs. So you are going to get 70 seconds to answer each question. Like any other exam, how to prepare for AKT, that is step 1 of UKMLA. First thing is time commitment. Obviously, you need to dedicate some time, you need to be dedicated, you need resources, like any other exam. On average, you need 3 to 5 months to prepare UKMLA step 1. Resources for me, I think the best resource is Clappable and Gravel Keys. These two are the main resources. If you have one, so these two resources, if you have done it well, I don't think so that you are going to fail. Like this exam is, I would say, it's easy exam. If you have prepared well, you are not going to fail this. So the curriculum of UKMLA step 1, that is available on GMC website. The blueprint is available there. I was going to the blueprint yesterday, and everything is there. These topics would come, and from where MCQs are going to come. Everything is written there. Further, if you need help to prepare, you can consult the resources which I already mentioned, Grammar Keys. So time management is about Lab 1, that is now AKT. If I am to give you a single advice how to pass this exam, that is you need to manage the time. Like the statements are too long, But if you are going to solve the MCQ in 72 seconds per MCQ, you are going to pass the exam. So the second part is use of the UKML CPSA. So it is actually the clinical based exam. It is only conducted in UK. The step one will be conducted all over the world and it occurs 4 times per year. So for Class 2, that is now CPSA, you need to go to UK. It is not conducted in Pakistan. So you need to book the exam and then the visa is, you need to apply for the visa and then you will go to UK and it is conducted in Manchester and you can book the date according to your circumstances. So what is Lab 2? Lab 2 is it is a direct interaction with the patient or the attendant. Like it is a simulation in which a patient is sitting in front of you and you are going to interact with the patient, you are going to take the history and then the management and diagnosis to the patient. And the third person in the room is the invigilator or you can say the observer. He's present there and he's going to judge you and he is going to give you marks. And at the end of the day, you are scoring above average and you will pass that station. So it is a live interaction with the patient and there is no theory involved. So it is a combination of simulated consultations, clinical scenarios and role-playing exercises. And what they judge in the exam? In Lab 2, they judge the clinical skills, communication abilities and professional conduct. They even observe your posture, the way you are talking, if either you are showing the empathy to the patient or not. All these things are observed, your body language is observed in this exam. So for preparation of step 2 of the campaign at the CPSA, unfortunately we need to book the academy. Like if you are not going to book the academy, then it becomes a bit difficult. So in order to have a blueprint, how to prepare the station, how to take the history, what to do in the management, you need to have a book and academy. And there are several options available. I will tell you now. So these are the resources in addition to the academy. These are some YouTube videos which helped me a lot. You can insert Inkimat, Expressmat and EastCup. This will help you prepare for the exam. There are different academies in the UK and every academy has its pros and cons. For this I would say that you should consult your seniors. I booked Aspire Academy, many students to the common station. Nowadays, most of these one of the best academies in the UK. So it depends. You can always consult this with your seniors and you can join the best academy. तो ये तो एग्जाम के बारे में आपको बता दिया. आप किस टाइम पे आपको इसकी तैयारी करनी चाहिए, एग्जाम आपको किस स्टेज पे देना चाहिए. स्टेप्स के बारे में तो लोगों ने बताया कि स्टेप्स जो हैं द प्रिपरेशन शुड बी स्टार्टेड ड्यूरिंग योर मेन एमबीबीएस. लैब ऐसा एग्जाम है जिसमें आपका एमबीबीएस के दौरान जो है उसका कोई इतना ताल्लुक नहीं है, जिसकी वजह से इसकी हाई की रेट नहीं होती, क्योंकि आप ड्यूरिंग एमबीबीएस जो है इसको एग्जाम को आप नहीं दे सकते. तो उसका फिर यही है कि आप जैसे ही आपका फाइनल ईयर जिस तरह रिसेंटली पास आउट हुई है उसमें जैसे ही आपका फाइनल ईयर का रिजल्ट आए, you opt for the IELTS or WT and clear the English proficiency exam. Once you have cleared, then at the start of your household, I will advise you to book the Class 1 exam. Alright? So that is the best time. And some students they ask me, what should I do during MBBS to score better in Class exams? The answer is focus on your clinical subjects, like in 4th year and final year. Focus on your clinical subjects, solve scenarios. That will help you a lot in future. But the preparation of lab, if you want to start early, and you should start early, now you have the guidance, you should start during housework. Before housework, pass IELTS or waiting, get the required score, and then book the Class 1 exam. And at the end of your housework, give the exam. Alright, so after completion of housework, maximum within 8 months to 1 year, you will be GMC registered. If you start early, and as I already mentioned, you have to start before housework, after you have graduated, after you have given the final draw. So this was it from my side. Thank you so much.